Hi everyone. Let me start by saying I'm in no way an expert on mental health or treatments available. I'm only here to share my story and give my opinions. No pity party here. My hope is that I can connect with one or even more people that may be going through something similar. My memory is horrible, so you may see me reading off of note cards that I've made. Okay, my background. For many, many years, I have suffered with depression, even attempted suicide at the age of 8. I've seen so many therapists, psychiatrists, taken almost every medication out there, and read every self-help book that I could get my hands on. None have worked. Recently, I lost a job that had my heart and that I was very good at. I was an EMT paramedic. Because I've been through so much, I was really able to understand and empathize with what most of my patients were going through. Don't you hate when people say automatically, I know and understand what you're going through, when they have no idea? Well, I was able to understand. Because I've been through child abuse, verbal, emotional, and physical abuse, I was molested and raped at the age of 8. But I believe that I went through everything as a child and early adult to be able to help others. I got emotionally invested in each of my patients, which can be mentally exhausting. But I was meant to do this. For that reason, I wouldn't change a minute of my life or what I had gone through, which leads me to now. I had to stop being a paramedic due to PTSD problems, which resulted in progressive memory loss, anxiety, and depression. It got so bad that I could not recall my protocols, which can be deadly to my patients. So I chose to leave my profession, something that had made me feel fulfilled and so very happy, changing lives one person at a time. I've been through so many ups and downs, trying to hide what was really going on. I was presenting a facade to the world, with only my husband and daughter knowing how bad I was. My godsend has been a doctor that I was referred to at the Salisbury VA. He and I have been very proactive with medications, but even at the maximum dosages, it's just not helping me. I was initially diagnosed as depressive for years. I was hoping to be accepted to try the ketamine infusion therapy. However, I was not a candidate. I was finally diagnosed with a mood disorder, the horrible bipolar. This can be a catch-all diagnosis for some doctors who don't want to be proactive. I am so blessed that I was referred to a doctor who specializes in bipolar disorders. It is such a negative connotation when talked about, but it truly is a mood disorder, and when medications don't work, it can be devastating to you, your family, and even the general public. As my doctor has said, you can tell bipolar when the patient is having a meltdown, even with normal life challenges. But after they decompress and get out their frustrations, they can be some of the nicest people to deal with. Lately, I have been purposefully trying to slow down my life, even my driving. Every day, it feels like I'm going 100 miles per hour while doing everything. It's not mania, just in a hurry to do things. I didn't realize how exhausted I've become trying to slow down to be normal. But then again, what is normal? So this is my countdown to ECT. I've made a very proactive decision to have ECT, electroconvulsive therapy. Yes, I will be put under general anesthesia along with a muscle relaxant and be purposefully put into a seizure. My first session is this Monday the 17th. I will be sharing my thoughts, feelings, hesitancies, and hopes during this process. I know so many people say, if I can help just one person, well, you know what? I believe that. I recently read that only 1% of people diagnosed with mental health problems seek out ECT. It was shown in the movie One Flew Over a Cuckoo's Nest as a barbaric procedure way back then. It's come a very long way since then. Do you remember when Michael Dukakis ran for president? Well, his wife Kitty Dukakis has come forward to share her story about depression, substance abuse, and ECT. I recommend watching her interview on 60 Minutes. After watching her and researching even more, I made my decision to commit to trying ECT. I'm scheduled for 6 initial sessions. I may need more, and I may need maintenance sessions to help keep me in remission or at a therapeutic level, maybe once every 2 or 3 weeks. It's all tailored to me, so right now we don't know. And that is no problem when you've had so many miserable years you are willing to try almost anything. This also may mean that I will still have to take low doses of meds to maintain my new normal. But I'm really excited, but I have not been in a truly positive mindset since the age of 7, and I just turned 50. I'm going to share my reservations about this procedure, but I also have high hopes for possible remission or betterment of my symptoms. I would like to have you along for my ups and downs, what it's really like to go through this. I'm also opening myself up for ridicule. My friends and family have no idea what I've been through, but remember, I want to help others, taking away some of the mystery of this disease and possible methods of help. I will continue to post about what I'm going through as I'm going through it. My first treatment is Monday at 1 p.m. Eastern Standard Time. As soon as I've recovered from the anesthesia, I will post the good, the bad, and the ugly. No sugarcoating, just the straight up truth. I'm not expecting a massive change the first several sessions, but baby steps are good too. I hope you will continue on this journey with me. Please feel free to email me at medicangel@yahoo.com. And please, if you are suffering in silence, please seek help. Start with family, friends, and medical staff. Remember, baby steps. Thank you, and I'll see you again.